Vance from Mississippi State University. So just a few brief intro words about Professor Vance. She has very interesting background in chemical physics, in biophysics. She was interested in how these things like measurement methods work for chemical and enzymatic reaction dynamics. Then she was interested in spectroscopic approaches for analysis in biological systems. So she studied Biophotonics, and that all accumulated, and now she's doing a wonderful work in the preservation of wildlife. And she's using spectroscopy, and recently, maybe from 2 years ago, she started using also aquaphotomics for detection of diseases and other actual conditions in animals. So, Professor Vance, please.
Hi. Can you hear me okay?
Yes.
Yes.
All right. Great. Let me share my screen. I'm supposed to start with. Is that working? Is that working okay?
Yes.
Yes. Yes. Thank you.
Do you have the full slideshow or the half one? Got the full one?
We have both.
The full is better.
The full. Okay, I'm just trying to make sure it's on the right. Let me here. It asked me to share. Let's see if I got the. There we go. It's all about which one is the screen 2. Now it's this one. Here we go. There, how's that? The full is that the full version there?
Yes.
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 Okay, good. I got a bunch of screens here. All right. Well, first of all, I want to thank you all for inviting us to the Aquaphotomics conference. I know last year we were really looking forward to being able to come out last spring or even November when it got delayed by COVID. So we have been looking forward to meeting up with you. And I am only sad to say that we cannot come out while Romania is still at the university, but it sounds like you're still going to be there. And if we can get out that direction on the other side of the planet, we would love to be able to meet up with you and Jelena and say hi and see your laboratories. So congratulations on your retirement. And I enjoyed the talk last night. It was lovely. So
thank you very much.
We we're very honored to be here, Mariana and I both, and we work together. She will be giving the next talk. This is going to be fairly lighthearted. As Jelena said, we have been applying spectroscopic approaches to animal physiology, and we do a lot of reproductive physiology, and now Mariana and I have been talking more about disease physiology and responses, and finding ways to do more rapid diagnosis of disease in animals in a non-invasive and in-field real-time modes. So that's where this comes from, and today I'll be talking about our application of aquaphotomics for profiling of the blood, serum versus plasma, and how these offer complementary modes of discriminating Manheimia hemolytica infection in dairy calves. So I'd like to start off with, let's see if I got this going, there we go. One of the biggest problems we have in the US is bovine respiratory disease. Bovine respiratory disease is a multifactorial, multi-pathogen condition that affects the lower respiratory tract of cattle, and it results in bronchopneumonia. It can be caused by a variety of pathogens. There are quite a few viruses that are involved. Like I said, it is a combinatorial disease vector system by which several pathogens can compound on each other and amplify the difficulty in assessment. But the variety of viruses that we have listed here include everything from parainfluenza virus, respiratory syncytial virus, herpes virus, and even a bovine version of coronavirus. But it also has, let's see here, there we go. It also has several bacterial pathogenic components that may come in as, and these are, you can see here is Mycoplasma histophilus. But the one we're going to be talking about here is the Manheimia hemolytica. This is the most common one that is the natural component of the animal's respiratory tract. And what happens is when the animal becomes overly stressed, different types of stresses, such as moving around from farm to farm or weather or whatnot, can actually activate the susceptibility of this upper respiratory tract virus system, bacterial system, and especially if viruses can be compounded in there. And this creates a whole collapse of the infection into the host's lungs, and creates effectively a pneumonia type of system that follows that inhalation and colonization of the bacterial systems into the lungs. So this particular disease has numerous symptoms that are very weak, let's just say weak. They're the types of things you would kind of figure right off the bat, so it doesn't necessarily identify this disease as, let's see if I can get this going here. Hold on, I guess I'm on the wrong thing. There. Okay, there we go. It has several fairly weak symptoms. They're kind of the standard symptoms that you see with most any kind of disease. And then the modes for diagnosis are actually quite difficult. So it's commonly diagnosed by visual and clinical assessment of the cattle, basically a VCD analysis, which is the types of things that you might think about in your own pet not looking like they're doing well. So presence of depressed attitude and appetite, increased shallow respiratory rate with coughing, nasal and ocular secretions, and fevers over 40 degrees C. So the problem is that the visual and clinical diagnosis is only about 62% sensitive and 63% specific for the BRD infection. And unfortunately, this means that asymptomatic or mildly symptomatic cattle and those in the early stages of the disease commonly go undetected and remain untreated with their needed antibiotics for this particular pathogenic threat. So when we have that type of a sensitivity at 60%, that means that over 38% of the infected individuals themselves actually go without treatment because they're never diagnosed. At the same time, when you have only 63% specificity, it means that there are a whole lot of cattle that are also treated that really don't have the disease, and therefore that leads to a lot of waste and concerns in rising antibiotic resistance for over-treatment within these large cattle lots. So some of the other more recent approaches for assessing this particular disease are the other types of things that you might consider serology and various blood analysis or diagnostic examinations, pathogenic isolation, identification, and plating of growth of the pathogen itself, or immunohistochemistry that would occur. And of course, we all know what that is. Some measurements for haptoglobin via enzyme-linked immunosorbent assays, and acute phase response proteins and early indicators of inflammation. There's also a variety of molecular tests that are out there that are being used more readily, and these would be for direct detection of infectious agents in the nasal swabs and saliva, or metabolomics profiling by multi-channel nuclear magnetic resonance, and volatile compound biomarker analysis in animal breath condensates. And this is done through more volatile systems using gas chromatography and some more recent attempts to classify this. Another large and very effective mode of analyzing this disease is called thoracic ultrasound. And thoracic ultrasound, although quite effective and with an 89% success rate in prediction, it also is very invasive. And the animals almost need to be brought into a hospital for that procedure to take place. So what is the economic impact of this particular disease? Well, throughout the US, it is approximately $1.6 billion impact on the US cattle industry. So with a 75% morbidity and a 50% mortality, disease is very serious, and with its difficulty in being able to be properly detected, they're always looking for modes for better diagnosis and treatment. However, there are a lot of problems with just randomly trying to diagnose and treat every animal, in the sense that the costs of therapy and prophylaxis are quite steep and counter the costs of benefit. You have a reduced performance in the animals that do survive the process. You have transmission and herd susceptibility when animals go undetected. And you also have antibiotic resistance. So with that, our purpose and objectives in terms of addressing this disease is basically to look for means to circumvent the invasive and time-consuming single assay analysis of traditional methodologies in detecting bovine respiratory disease, no matter what its particular pathogen. So we are looking to develop a more rapid, field applicable and real-time diagnostic tool to detect it. And to this end, we want to test if NIR aquaphotomics can be used in the disease diagnosis in several of the different biofluids that may be available. And this includes nasal secretion, saliva, breath, condensate, and various modes of blood matrices. Our first goal was to examine the aquaphotomics as a measure of disease using blood plasma and serum. And then from there, go on to look at these other fluids that we have already mentioned, the nasal secretions and saliva and breath condensate. And this is largely because blood plasma and serum are fluids that are readily used in the singular component serological and immunohistological analysis in the traditional approach. And they're being collected anyway. So if we could even have a more rapid analysis for using just those fluids themselves, rather than having them go through the processes that are in the clinical and chemical analysis, it might itself even be an advantage from where it is now. To that end, our objectives are to establish first a spectral information, what spectral information is available in the blood serum and in the blood plasma, and compare these two. We also then want to use aquaphotomics to map changes in serum and plasma spectra as a function of the Manheimia hemolytica infection, and then determine if either or both of these modes and matrices for analysis can give us prediction of Manheimia induced BRD in cattle that may be equal to and or better than what can be done with the multitude of clinical visual diagnostics that are currently in place with such little application, or with such low sensitivity and specificity. So for this project, we designed a challenge to infect the animals and test pretty much the before and after of that particular pathogenic complication that would be obtained. So infectious agent challenge, that's the phrase. Challenge studies offer a controlled and standardized condition in order to follow the infection progress and enable a direct comparison across disease stages. What we have here is a controlled disease challenge in which Manheimia hemolytica bacterial infection was administered to 5 non-vaccinated and immunologically mature Holstein steers that were housed at the MSU South Farm under the College of Veterinary Pathobiology and Population Medicine. The animals were constantly in the care of veterinarians for any kind of emergency that might have arrived, and the experiments were all carried out with the approval of the MSU Institutional Animal Care and Use Committee. For the controlled challenge, Manheimia hemolytica isolate D5 D153 was prepared and given via bronchial lavage catheter, and blood samples were collected via jugular venipuncture into 2 commercial blood collection tubes at the time, one of them containing the anticoagulant thionium diethyltetramine. The blood samples were collected and processed to obtain the plasma and serum separately, and pre and post challenge during the 4 baseline days that are indicated in the blue before the challenge, and of the day of the challenge, because the animals don't actually get sick for a day, and then 11 days immediately after the challenge, followed by collection every other day until day 23 post-infection, which is the known time for when animals typically will self immune response and get back to normal health if they're being monitored. We had on standby antibiotic treatment should any animal come in more sick than we were comfortable with. So they continued to be monitored. The blood samples were collected through venipuncture at the jugular in the 2 tubes, as I mentioned, and the samples are centrifuged in each case, allowing the blood to clot in the serum, and centrifuged, in the plasma, the samples are centrifuged in order to pellet out all the solid materials and the cell compounds, whereas in the serum, the coagulation process is allowed to occur and separate out the remaining non-solid components, as well as a difference in the fibrinogen clotting factors. Both of these tubes then were stored at minus 80 degrees C until they were analyzed for their NIR spectra. Now, I'm starting to see, sorry. Okay. So, all right. So we also at the same time took visual clinical diagnosis and complete blood counts from all of these samples as they were collected on site. The variety of information that we took with regard to the VDC analysis is in the following table that I'm going to be showing, but it basically is analyzed by ANOVA and pairwise mean comparison, where we applied students t-test with alpha set at 0.05. Okay. All right. So all right. Oh, let me try to recap here. We have a total of 18 blood samples collected for each calf over the 23 days. So a total of 43 blood samples. The results for the visual clinical diagnosis in response, you can see in this particular table, there was a lot of data that was collected, and the values of these types of assessments are shown where significant difference occurs between baseline and infected. And what you can notice is really all of these means by which visual clinical diagnosis is used to detect this disease, very few of them actually have any particular significant difference that would flag that this disease is in course for these animals. And most of this is occurring as a result of these animals during the highest peaks of where you expect to see them being sick. So the difference here, you can see that these traditional modes by which the disease is detected are actually quite weak in their ability to predict or identify animals that need treatment. So that brings us then to the NIR spectral methodology that we employed with regard to the application of Aquaphotomics. Our NIR spectra were collected using a portable spectrophotometer from the ASD Field Spec 3 and Indico Pro chemometrics software. Our analysis were performed using the unscrambler as you can see here. And we basically then worked in the first overtone region of the spectrum for the vibrational combination band between 1300 and 1600. Our aquaphotomic profiles, including barcodes based on the WAMAX and aquagrams, were created following the published procedures. So a quick picture of the transformed and raw and transformed spectra to just kind of show you the difference in the blood, plasma, and serum. There's nothing quite obvious. You can see that there's some slight differences here in the baseline versus infected after transform, but the details in the PCA and the PCA LDAs will be more apparent as we go through. So here are the PCA results. These were run by Mariana. She's done a great job. Basically, the first couple of PCA principal component analysis show that the first two PCs cover up to about 66% of the sample differential or range in the system, and then next to this you have the loadings shown for the PCAs. Now this is the plasma PCA results, and the next one shows then the serum PCA results. Again, you have the about 2/3 of the variance being covered by the first couple of PCAs, or principal components. So from there, what we looked at were then the water absorbance bands in the selection. These were differentiated against sterile water, which was millipore filtered water, and it was autoclaved. All spectra are collected in 1 millimeter quartz cuvettes that are matched, and all the spectra then are then averaged for any variation in those particular, even ideally matched wavelengths. So you can see we've got in here plasma and serum, and we've got the 12 water absorbance bands outlined, and you can see that there are some real differences between the baseline and infected in both systems of the plasma and the serum matrices.
Wow, sorry, just 1 minute left.
Oh, sorry. Okay. So I will go on faster a little bit. So from the water bands, we have plasma versus serum barcodes. This is just to show the difference in the baseline variance of the plasma and serums. It's a direct comparison. The biggest differences are in the C1, C5, C9, and C11 bands. And those particular frequencies. So if we compare then how both plasma and serum alter with regard to the baseline and infected forms, what you can see is that the serum tends to have the largest changes in the earlier bands, the C1 through C5 bands, whereas the plasma actually seems to have most of its changes up in the higher bands of the aquagram and of the WAMAX code, and you can see then also the differences within these aquagrams between baseline and infected. Basically, the story is that serum and plasma are telling different parts of the overall story that is occurring within the baseline versus infected samples of these animals. And our hope is that if one can tell us some more, then maybe the other can also be added to it and provide even more information. One of the big differences is in plasma and serum is that plasma actually contains a lot of fibrinogen, which is one of the major clotting factors, in a fairly high concentration. And that could very well be a factor with regard to the tight hydrogen bonding networks that would have been observed here in the plasma in the other sense. So that brings me to the end. We've got the last thing is that the plasma does give us pretty high predictability in our external validation for infected versus non-infected animals. And that's our biggest message out of the whole thing, is that plasma really gives us some information. We also are looking at doing some nuclear magnetic resonance profiling as well. So here are my last couple conclusions. It's basically what I've already said. We can see different signatures between the WAMAX and the barcodes for serum and plasma, and that the plasma gives the best predictability, and yet they still seem to be measuring different components within the overall changes of the system. So thank you all, and sorry if I went longer than I was supposed to.
Professor Vance, thank you very much. I'm sorry, we really ran out of time, so we don't have time for questions at this moment. I would have to switch to another presenter. Thank you very much once more to Professor Vance. And now the next speaker is a student of Professor Vance, a beautiful and very, very smart lady, Mariana Santos Rivera,